It's 4:15 in the afternoon, and you're waiting for your high schooler to come out of school. The school bell rings, and all these kids start to pour out. As you're watching the kids come out of the school building, you notice a group of them across the street over the other side of the school campus. They gather around, talking, probably discussing their day, until you notice a few of them pull out a packet of cigarettes or even an e-cigarette and light away. And you start to wonder to yourself, man, that is really a really bad habit to have at such a young age in life. Just as you're pondering on that thought, your own student comes out of the building, and they too see this group of kids across the street, and they're watching with full attention. And you wonder and you hope to yourself, man, I hope they are not wanting to experiment with tobacco. I hope they're not wanting to try it. And you wonder to yourself, what can I do? What can I do to prevent for my child, my grandchild, or any child you hold dear to you to keep from wanting to try such a dangerous product? That is why increasing the age limit to 21 to purchase tobacco products must go nationwide. It will decrease the percentage of young adults picking up this habit. It would also reduce the number of smoking-related deaths in this country. And it will lower healthcare costs related to the prolonged use of using tobacco products. In 1964, the first Surgeon General's report came out by Dr. Luther Terry. And in his report, he stated that more than 20 million people died from premature deaths in our country due to the use of tobacco products. This information comes from the Centers for Disease Control and Prevention, the CDC website, .gov site. That is an incredible high number of people dying. You may be asking yourself, what can we do? What can be done to prevent our youth from picking up this habit? What efforts have been done already? Well, I can tell you, back in 2001, a group of people made it their full role to go after the retailers so they can discourage the young youth. In their event, they were able to hold retailers accountable to be in compliance with the 18 over rule. And at the same time, they were able to eliminate the cigarette vending machine. This caused a drop of underage smokers to 19% who purchased from the store. However, you have the other aspect is teenagers have social contacts. Many of these teenagers, 12, 13, 14, 15, do know a 18-year-old or 19-year-old. But what is the likelihood of one knowing a 21-year-old? In a recent article on the WebMD page by Stephen Weinberg, an article entitled, Raising the Legal Smoking Age to 21, U.S. Expert Panel Says, and the article reads, that younger teens, yes, they do have older teens to purchase cigarettes for them. And they know a lot of friends under the age of 18 and who are 18, 19 years old. However, the unlikelihood that these young teens know a 21-year-old is unlikely. That is why raising the age to 21 seems to have the most public health benefits. My second point to address is the decreased smoking-related deaths in this country. According to another article, a journal in the American Journal of Public Health, two lawyers by name Moran and Malik state the following. If implemented nationwide, Tobacco 21 will likely secure a substantial public health benefit. According to the Academy of Medicine, raising the minimum age to 21 years nationwide would result in 223,000 fewer premature deaths in our country related to smoking between persons born between 2010 and 2019. That is a lot of young lives that can be saved, which brings me to my next point, is the financial aspect of implementing this law nationwide. As it stands right now, we spend millions and millions of dollars on healthcare costs due to the damaging effects of smoking. We all know someone who has either died or is suffering from the prolonged use of cigarettes. Many of these costs are paid by the federal government through Medicare, Medicaid, and other funding government programs. Where does the money come from? Well, our health and state taxes take on the burden of paying for these health care benefits. By reducing the number of adolescents picking up this habit in the beginning, this will ensure that there will be no habit smokers in the future. Less deductibles, less hospital visits, less doctor visits, which means less co-pays and out-of-pocket expenses. This will eventually saves everyone time, money, and most importantly, their lives. In conclusion, even though critics dispute this law, but the facts I provided prove that the benefits far outweigh the negative. Protecting our young adults is invaluable effects. And this is something that we must do. It's imperative that we do this. We must ensure that our next generation is smarter and healthier. By passing this law nationwide, this will ensure that these goals are met. Will you stand up behind the Tobacco 21 law in your state? Will you stand up for your children? Thank you.